Hi there. February 28th, and we are going to talk about something that a lot of pro choice people are really going to find difficult. Uh, you're probably going to want to cover your eyes, hold your ears, shut off this video because it's going to be information that you most certainly don't want to hear. But if you or somebody you love is trusting Planned Parenthood, it's something you need to hear. Okay. And it's not just this one death today, although I'm going to start by talking about the death of 25-year-old Diana. She was 19 weeks pregnant when she went to a Planned Parenthood in Southern California for a safe legal abortion on February 28th of 2000. Before the day was over, she had bled to death, leaving two little boys, a 4-year-old and a 2-year-old, motherless. And the taxpayers of California paid for this via Medi-Cal. Now, after the abortion, Diana was suffering complications. They rushed her to the hospital and performed a hysterectomy, gave her 5 units of whole blood, but that didn't fix her perforated cervix and she bled to death. Now, her husband followed suit, saying that the reason she was injured and the injury wasn't caught is that Diana's abortion was rushed through in only 6 minutes, even though Planned Parenthood's website says that abortions at 19 weeks should take 10 to 20 minutes. And also, Diana's husband faulted Planned Parenthood for proceeding with an abortion, even though Diana's hemoglobin levels were low to begin with. Um, Now, the family's attorney noted that in 2000, that same Planned Parenthood had rushed another woman through a similar 6-minute abortion, lacerating her cervix, rupturing her uterus, perforating her sigmoid colon, and causing the loss of 2 liters of blood. And then they delayed 3 hours before transporting her to a hospital. Now, fortunately, she survived. The medical board took no action against um, the doctor who performed Diana's fatal abortion, Dr. Mark Mautzer. However, the California Department of Health Services investigated the Planned Parenthood, and they cited them for, among other things, failure to institute a necessary change in the medical protocol related to the use of laminaria in their D&E procedures, lacking evidence to show that they completed an assessment of the competency and credentials of Dr. Mautzer, inadequately advising against performing a potentially dangerous second trimester abortion based on Diana's low hemoglobin levels, failure to follow proper surgical abortion policy and procedure by administering Cytotec to her on day 1 of the 2-day procedure when they're supposed to be administering it 90 days before the procedure starts, and keeping incomplete records about the services they provided to her. Um, Now, Planned Parenthood said they made corrections of these things that the state cited them for, but that doesn't satisfy Diana's family. Um, Her older sister said it was wrong. She was healthy. She was fine. Now, I have some skepticism about the quote unquote corrections because 5 years later, at another Southern California Planned Parenthood, a nurse placed laminaria in the cervix of a young woman named Adrika in preparation for an abortion, in spite of the obvious signs of a vaginal infection. Now, laminaria are seaweed sticks and they absorb whatever moisture is in the area so that they can expand and dilate the cervix. Well, you put them someplace where there's an infection, they're going to wick that infection straight up into the uterus, and that's what happened with Adrika, and it killed her. And we look at the failure to assess competency and credentials of staff. That brings me back to a major failure that this kind of, to me, shows a very, very long-standing and nationwide issue. Clear back in 1981, an abortion patient named Elise in Massachusetts suffered an asthma attack after her abortion, and they started to resuscitate her. When the medics arrived to take over Elise's care, they found that evidently nobody on the site even knew how to perform layman level CPR, much less the professional type of CPR you'd expect in a medical facility. One nurse was doing compressions on Elisa's abdomen rather than her chest, and the other one had one of those ambu bags, but instead of having um, Elisa's airway open so that her lungs were being inflated, it was puffing her cheeks and not even noticing they were doing that. And the medics took over and performed competent CPR, but unfortunately the brain damage had already been done and Elise died. And there are some other women I know of who died after abortions at Planned Parenthood. A young woman named Cree, 24 years old, suffered internal injuries and still was sent home. Um, she died in July of 2016. A young woman named Tanya in July of 2012 went to a Chicago Planned Parenthood. She was hemorrhaging after her abortion, and they delayed sending her to the hospital for about 4 hours, and she bled out. And then there were two young women in Southern California, Holly, age 18, in September of 2003, and then Vivian, age 22, in December of 2003, were both given abortion drugs for a medication abortion, and they were told to administer them in a way that was unsafe, that was associated with toxic shock syndrome and fatal infections. And both of these young women got infections and died. So I think it's pretty clear that Planned Parenthood isn't upholding their standards. Um, I don't think they should be trusted just because of that giant PP they have on the door.